In recognition of the extraordinary work of Cahaba Medical Care in advancing maternal health in underserved populations, the Health Resources and Services Administration has chosen Cahaba Medical Care's headquarters in Centerville as the location to announce its nationwide initiative for maternal health. At this press conference held this morning at the office of Cahaba Medical Care, HRSA will be awarding Cahaba Medical Care with new funding for maternal health initiatives. The event included a roundtable discussion highlighting Cahaba Medical Care's remarkable contributions in the field. The new $2 million funding from HRSA includes the launch of its National Maternal Health Initiative and the broad vision for improving maternal health in underserved communities nationwide, and is being announced here in Bibb County with Cahaba Medical Care at the center of the attention of the $65 million initiative being announced by the Biden Healthcare Initiative. The group gathered this morning in the offices of Cahaba Medical Care at 10 a.m., and the announcement was made by Carol Johnson of HRSA to welcome the group to Bibb County.
$65 million in our new initiative to tackle the maternal mortality crisis. And as part of that, Cahaba Health Center will get a $2 million award. They are one of only 35 health centers across the country getting this award. We have 1,400 health centers, and they are one of 35 getting this award because of the critical work that they're doing here in Alabama and the critical needs here in Alabama to make sure that we're addressing the needs of pregnant women and new moms.
You touched on it a little bit, Carol, but what was special about Cahaba here in Bibb County that led you guys to choose them to have this initiative?
Yeah, Cahaba came forward with a really terrific proposal to tackle one of the leading causes of maternal mortality and morbidity, which is really underlying chronic disease. And so Cahaba's really put together a thoughtful proposal for how they're going to work with women across the community, both here directly and in reaching out to people who aren't necessarily yet patients of the center, and making sure that they get preventative care, making sure they get connected to prenatal care early, making sure that their chronic disease like hypertension and other cardiovascular risk factors that are causing far too many tragic deaths of women during or post-pregnancy.
How important is this for women here to have this blessing that you guys are handing over to Cahaba?
So it is a partnership, and we're so delighted to be in this partnership with Cahaba, and we think it's going to make a huge difference in the community. And so, for far too long, women's voices have not been heard, and women's voices need to be heard, and that's what this health center does. And so we're delighted to be able to help expand what they know works and what has worked for the hundreds of women who they help deliver their babies every year.
From a practical point of view, what would this grant pay for? I mean, how does it work?
Yeah, it's a terrific opportunity for the health center to be able to expand the type of supports that women can get, hire additional staff, provide additional resources, provide additional time and access to be able to get the kind of supports that we know matter when it comes to good maternal health outcomes. So getting connected to the community, recognizing what women need, and being able to provide it directly.
Great job. Anything else? You nailed it.
Fantastic.
Thank
you all.
That was great. Wasn't too bad, was it? We weren't too painful.
That was wonderful. Thank
you
all.
Carol. All right, Dr. Wakes, go ahead and just tell us your first and last name, spell both for us, and give us your title, please, sir.
John Waits, John Waits, and I'm the CEO of Cahaba Medical Care.
Wonderful. Carol talked a little bit about the proposal that you all had to get this funding. Tell us about that process, what it looked like, and how grateful you are to be in this position now.
Well, the process is a competitive federal grant, so there was a lot of brainstorming, a lot of writing with our team. Being involved in the care of infants and pregnant women is something that we've done before. We have numerous public and private partnerships with other entities like Bibb Medical Center and UAB, and then several different grant proposals over the past with the Health Resources and Service Administration, HRSA, in this space. So we were excited when we saw this grant opportunity come along and wrote the grant and are excited about this opportunity today.
The bottom line is that you're helping women with this money. How exciting is that for Cahaba to have this tool to help women with healthcare that they need?
It's really exciting, and it'll build on some of the work that we've already done. So there was a joint venture with Bibb Medical Center back in 2015 where we reopened labor and delivery. We've recruited 12 family medicine obstetricians and 3 OBGYNs to our team. We serve in 4 different labor and deliveries around central Alabama. What this particular grant will help us do, we've identified a gap, a real need in providing social workers into the interdisciplinary team and providing community health workers to meet patients at the point of need when they have chronic diseases that impact maternal mortality, but they're just not able to get into the office, and we need to provide additional support with the social determinants of health. So this funding will be pretty creatively implemented in that way.
How much is the grant altogether?
I'm still getting up to speed this morning, but I think it's just short of $2 million.
And it's a one-time block of money, if you will?
It won't be ongoing funding. It'll be a one-time project. I believe the project period's over 2 years.
Dr. Waits, what does the need for this kind of care look like here in Bibb County? What kind of tragedies do you hope to diminish with this funding?
Right. Well, some of the contributions to maternal mortality really relate to chronic disease. It's multifactorial. I mean, if it was an easy solution, somebody would have already figured it out, but it really takes numerous partnerships and kind of hitting on all cylinders. We're going to really focus on the social determinants of health in helping women care for chronic disease while they're pregnant. So things like heart disease, hypertension, diabetes, while maintaining a pregnancy, so that it gets really complex. And if you're proximate to an entity like UAB, it works. The further remote you get from tertiary care, it gets really hard to coordinate all the care that's necessary. So we hope to just up our game in that area.
According to the press release, it says $65 million is the entire funds. Out of that, Cahaba gets 2. I just want to clarify.
I think that's right. I'm getting confirmation.
All right. So the 65, is that like nationwide?
It's nationwide, 35.
From the 35.
And Cahaba gets 2. Cool.
Yeah.
Dr. Waits,
Yes.
when is this plan of action, if you will, go into effect? Is it immediately or 1 month from now? Or?
I believe it's August that it'll start.
Great job.
Nice job, Doc.
Thank
Thank
you,
you.
Doc.
All right,
We
thanks.
appreciate you.
Thanks.
Thanks for your time.